Must not be much to do in Brunswick today. Welcome. There's room on the floor up here as long as the fire marshal doesn't come. You're welcome to come up. I don't mind company. It's a good thing, I guess. Those of you standing in the back, if you want to come up here, that's fine. There's two. This is reserved for Charlinda Gray. Does anyone know her? There. Bring a chair right up here. I can help you. Don't hurt it. There you go. There's a chair. I don't think anyone here has dementia because you all remembered to come. So that should make it easier for you. You're all here because you know someone that has a problem. And that's true. Many of us do know people with problems remembering. Don't worry, you're not in the way. Yeah, I know you as well, Don. There are some good things about dementia. You get to meet a lot of new people, the same ones over and over again. So, that's kind of fun, too.
Do you mind if I say?
So, Amy wants the microphone. I guess we'll share.
Yes, thank you. Hi, good afternoon or good morning so far. Thank you everyone for coming. First off, I appreciate everyone who might be experiencing a little discomfort while you're here because you're packed in so close to your neighbors. We do not have the ability to turn the air conditioning down anymore in this room. So if you get too hot, just pass out. We have a medical professional here and a few more in the building, and they'll take care of you. Otherwise, we had to move the water cart outside of the room. So please feel free if you're feeling too warm, and just be patient with me. I can, make a googly eyes at me and I'll get you some water. Otherwise, if you need to use the restroom, go out either of the doors at the back and to the right and take another right. That's where the restroom is. But otherwise, welcome to Midcoast Senior Health Center. We have a full continuum of elder care residences and care services available here. We have assisted living at Thornton Hall. We have memory care community at the Garden. We have long-term nursing care home at Deer Point, as well as Bodwell, which is our rehab and nursing center. And so there's some information over on the table there. Our next ounce of prevention will be the second Monday of the month in September. And it will be with Dr. Stamey, and he's going to be talking about movement disorders. If you haven't had a chance to sign in already, we have a sign-in sheet. I'm not sure where it is, but I'll try to send it around the room. It might look like a beach ball at this point. And I can send you emails that will remind you about future ounce of prevention presentations. Otherwise, there are several of us here who are able to answer questions. And if you may not have noticed already, we have someone here videoing this presentation from Headlight Audiovisual, and it will be available later today online. So if you missed anything, or if you want to watch it again, it will be available online, and we have some handouts that we'll be able to provide you to be able to take that home and find it online. Otherwise, Dr. Howe has created a handout. I hear we're out of them. I'm going to print off some more. So if you haven't received that, just let one of us know on your way out, and we'll get that to you. Otherwise, it's my distinct pleasure to be able to welcome Dr. Timothy Howe from Parkview Medical Associates. I did want to mention he's not accepting patients at this point, but that, who is?
Dr. Boyd.
Dr. Boyd is, I'm sorry, I wasn't quite sure when you said that.
Who's in the office with me.
Yes, he's accepting patients. And so without further ado, Dr. Howe.
You should probably wait until after the lecture and decide whether to clap or not. It's sort of like, we often say thanks for the food before we pray. Well, maybe we should wait till afterwards. And I understand that Jewish people sometimes have a prayer at the beginning and then one at the end as well. So then you could clap if it's worth it. Can those in the back outside hear? Can you hear all right out there? I can talk louder if need be, but I don't want to. They can't hear me. Okay. All right. I can always talk louder, but I don't want to offend anyone's eardrums. So we're talking about dementia and reducing our risk. And the first page of the handout, if you wish to go to sleep during, that's fine. Really, the important part is the second page, and that's about nutrition and things that you can do to reduce your risk. But I think a little background is always important. And so I'm going to talk a bit about the brain and some causes of dementia that are not related to nutrition at the beginning. So at the top of your handout, you have the words the brain. The brain weighs a little over 3 pounds, and yet it contains 100 billion neurons on average. That's a lot of neurons packed into a tiny little space. And those neurons, they have a cell body, and then they have a long tail called the axon. And you have about 100,000 miles of axons, all packed into that little space up there. That's amazing, isn't it? And what's more amazing to me is each of those neurons, each of those 100 billion neurons, can make connections with up to 10,000 other neurons. Now that's a lot of connections that can be made. The average person doesn't make all the connections they could, but the average person still does pretty well. They make up to 100 trillion connections. And the brain is truly amazing. Every one of those connections, each day you are making new ones and modifying old ones. Memory is an interesting thing. We used to think, well, once you have a memory, it's set in steel. It's set in concrete, set in something, doesn't change. That's not true. Every time you remember an event, you change that memory just a little bit, which is what's hard when it comes to court. You know, they say, do you swear to tell the whole truth and nothing but the truth? They should add, as I remember it, because we modify our memories. And that's not a bad thing, that's a good thing. Because what happened to you as a child, it gains meaning as time goes by. And so you change your memory of that occurrence. So our brains are continually changing. We used to think that you didn't make any new brain cells once you reached a certain point. When I went through medical school, they told us that that was at about 20, 25 years of age. Then you don't make new brain cells. But we know in the healthy brain, you continue to make new neurons or new nerve cells in your brain, particularly in the hippocampus. That's the area that we remember with all the way through our lives. So you've got 100 billion, but you're adding more as you age. So in the healthy brain, you get smarter and smarter. Isn't that good news? Yeah. So you can add more cells and make more connections, which is really, really fascinating. The other thing that a lot of us don't stop to think about is that the brain receives 20 to 25% of our blood flow. That's a lot for such a small little organ, and about 20 to 25% of our fuel consumption is in our brain. And it can go up as high as 50% of our total oxygen and fuel consumption if we're thinking really hard. So if you have a problem with your weight, you could exercise to lose weight, or you could just think harder, right? And so I'd recommend thinking yourself thin. And that's, you know, there's some truth to it. One of the problems, it's an interesting thing, they've done studies with TV, and because of they shift the focus so rapidly, If you watch TV and think about watching it, they shift the focus every 20 seconds. What that does is it puts the cortex of your brain to sleep and drops your metabolic rate. While you're watching TV non-critically, you burn less calories than you do if you're asleep. Yeah. And in fact, another way to lose weight is to read a book instead of watching TV, because your brain, when you're reading a book, has to create all the images, and you burn 10% more calories reading a book than you do watching TV. Maybe some of our dementia is because of too much TV watching. I don't know. I didn't see any articles on that, but it's an interesting thought. Never underestimate the brain's metabolic capacity. It is amazing when you think about it that that little 3-pound organ can burn up to 50% of your calories under periods of intense thinking. So I hope all of your brains are really cranking away, burning those calories right now. That's important. All right. So let's talk about dementias that are not related directly to nutrition first. And the reason I mention these is if someone has problems with their memory, it's important to exclude these as causes before we talk about lifestyle changes. Infections are a cause of dementia. We know that with HIV or AIDS. You've heard of impaired memory function in people with HIV, and that infection can get right through into the brain. It crosses the blood-brain barrier, and we're going to come back to that term blood-brain barrier in the future. But the lining of the blood vessels that go to the brain are highly specialized. They have really tight connections that keep a lot of things from getting over into the brain. But there are a few infections that can cross that barrier, and HIV is one of them. Another is Lyme disease. And so if you know someone with dementia and it's early onset or it doesn't fit, it's worth looking at some of these infections. Syphilis is a spirochete like Lyme, and we've known for hundreds of years that syphilis can cause dementia, just like Lyme can. Another one is low thyroid or hypothyroidism. If someone comes into my office and they are diagnosed with dementia but haven't had a thyroid test, I always want to check thyroid, because that can mimic dementia when it really all they need is more thyroid. Now, the vitamin deficiencies, you'd say, wait a minute, aren't those related to diet? Well, yes, they are, but it's usually from malabsorption or some other factor that these cause dementia. Vitamin B6 and folate is folate, and then there's vitamin B12 as well. If you're deficient in those, it's almost always a malabsorption problem rather than a dietary deficiency. But if you have those, you can develop serious dementia. I had a patient come in several years ago, and she was having real problems with her memory. We got a B12 level and it was undetectable. Supplemented the B12, and she came back a lot. Didn't come all the way back to normal because B12 damage in the brain can be irreversible to some extent. So that's important to test for. B1 or thiamine deficiency is rarely seen except in alcoholics. But in alcoholics, thiamine deficiency can cause a dementia. And then there's adverse reactions to medications. These can cause a dementia-like syndrome as well. And the most common ones are the over-the-counter sleep aids, the Tylenol PM and the Advil PM and the Sominex, and there's a whole category there called anticholinergics. Other ones that can also cause dementia are the benzodiazepines. These are the ones that are often given for sleep as well. And they're common names like Ambien and Xanax and Ativan and Valium. All of these can impair mental function, as can alcohol itself, which is a depressant like these are. And then some other causes. One of them is a subdural hematoma. That's where someone has a blow to their head, bleeds inside. It compresses the brain. It doesn't do it a lot, so they don't die, but it does it enough to impair mental function. And this is hard sometimes to figure out. Someone you just say, well, they're not quite right. And so in the evaluation of dementia, it's always important to get some sort of an imaging study of the brain to make sure that they don't have a subdural hematoma, which can be chronic and can cause a dementia-like syndrome. Then there's poisonings. Heavy metals can do this. Lead is the one we hear about the most, but mercury can do it. And other metals that aren't heavy, supposedly, I mean, they're still heavy if you pick them up, but they're not categorized as heavy, like copper. Excess copper is associated, particularly if you have a genetic tendency with the ApoE4 genetic changes, copper can be a problem. And how many of us have copper pipes? So perhaps it would be a good idea if you have a history in your family of Alzheimer's disease to filter your water and lower your copper intake. Although that's not a major cause of dementia, it's something to think about. You know, a simple thing like dehydration can cause dementia. Staying adequately hydrated does improve brain function. It doesn't cause dementia long term, but if you're dehydrated, it will definitely impair your mental function. So drink adequate water. Don't overdo it, but drink adequate water. What's adequate? Oh, about 6 glasses a day will usually do most of us. Unless it's hot like today, then you might need a few more. Brain tumors can cause a dementia-like syndrome. Again, a reason for imaging. And lastly, normal pressure hydrocephalus. It's an unusual disease. It's not found very often, but when it's found, it's very important to treat it. And you can have marked improvements in mental function. I've had several patients who came in with a diagnosis of dementia. I think of one in particular. She was admitted to the hospital. She couldn't talk. I asked a neurologist to see her, and he said the only thing for this patient is to send her to the nursing home. But I had known this patient for a while, and I thought, you know, this was just a little rapid decrease. I think I'll get a head CT scan. So I got one. The neurologist read it. He said, no, I don't think. I said, I'm sending this down to the neurosurgeon. So I sent the CT scan to the neurosurgeon, and he looked it over and he said, I think this patient has normal pressure hydrocephalus. Send her down. So we sent her down, put a shunt in, which shunts the excess fluid from the brain down to the belly, and she woke up. And she started talking, and she just did well. She's still talking, and this has been about 20 years. Her husband came into the office one day, and he said, could you put a valve on that so we can... Yeah, so you can overdo it sometime. No, it's amazing, and the other thing that we find in people that have normal pressure hydrocephalus, just for interest's sake, is they tend to have a wide base gait. They walk sort of like this with their feet apart, and they have trouble with urinary continence. So that's something that can be almost miraculous improvement if you find it. All right, let's go on to Alzheimer's and vascular dementia. This is the majority of dementias. The others, even with copper, are pretty uncommon. But as you'll see here, the majority of dementias are of these two types. Alzheimer's is about 60 to 70%. Some people say as high as 80%. And vascular dementia is somewhere between 20 to 25%, depending on the authors that you read. Both of these are related to genetics and lifestyle. As one person says, genetics loads the gun, and environment pulls the trigger. You know, it is really important who you choose for your parents. That's critical. And if you do a lousy job at that, then you better be really careful with what you eat and how you live. and most of us are in the latter camp there because we didn't do too good with choosing the parents. Vascular dementia is the one that is largely preventable with lifestyle changes. If you have bad blood flow to your heart, you get a heart attack. If you have bad blood flow to your head, you can have a stroke, or you can have multiple tiny little strokes, and that can cause decreased mental function. Really, dementia, going back to when we started up there about all those neurons, dementia is gradual loss of neurons. And you got 100 billion of them, and so you can lose quite a few before anyone catches on. In fact, there was a study done by David Snowden about 25, maybe 30 years ago now. It was called the Nun Study. He went into a convent in Chicago where they had a whole group of very elderly nuns, and none of them had any clinical evidence of dementia. They were all very active physically. They were active teaching in the community, and they were just amazing, these people that had no clinical evidence of dementia. Well, as time went on, he got permission to do autopsies on their brains when they eventually died. And the amazing thing is, on autopsy, many, if not most of them, had evidence of Alzheimer's on the brain biopsy. But there was no clinical evidence. Why? Because they were very active physically and very active mentally, and even though they were losing brain cells, they were still making some and making new connections. And the take-home lesson from that study is easy. I don't mind if you have Alzheimer's and I have Alzheimer's as long as I can't tell and you can't tell, right? There's some good evidence that the higher your educational level, that is, the more synapses you've made, the more resistant you are to developing clinical Alzheimer's, that is, showing the signs that you have it. Well, what if you didn't get that college education or that doctoral degree? Is there still hope? Yeah, there is. If you stay mentally engaged and really work that mind and every day are working to form new connections, you can make a difference in whether someone else finds that you have Alzheimer's or not, right? And that's really important. There's a difference between what we see at autopsy and what we see in real life. And that difference really depends a lot on how much you use your mind and how engaged you stay in life. Vascular, though, is very easy to work with, as we'll talk about. Now, there are 7 non-dietary risk factors for dementia that I'd like to cover. Then we'll go to the last page. And non-dietary is in brackets because, of course, you'll see the list is all related to diet. We just don't think of it that way at first. Diabetes increases your risk for dementia. About a 60% increased risk just having diabetes. So it's good if you have it to change your lifestyle so it goes away if you can. And with type 2 diabetes, about 80% of the time, if you change your lifestyle, you can make it go away. Midlife hypertension is also highly correlated with the development of dementia. So get that blood pressure well treated or make it go away with lifestyle changes. Midlife obesity. And the obesity in midlife that really gets you is the mid-obesity, right in here, around the middle. Have you noticed that you can weigh the same as you age, but everything kind of settles around the middle there? I've been fighting that as well. I think, man, gravity is just having its way with me, and it's tough. But that midlife, obesity is what increases the risk. Depression increases the risk. Interestingly, one of the best treatments for depression is exercise. Exercise is as effective as the best antidepressants we have at treating depression. And there, right next, physical inactivity. People who aren't active are at increased risk for dementia. And cognitive, that is not using your brain, kind of just watching the boob tube and, you know, putting it in neutral will raise your risk for dementia. Smoking does. There are several studies that have been done that show that if we reduce these 7 non-dietary risk factors just by 20%, half of dementia would be prevented. That's huge. That's just huge. And it's worth thinking about and taking steps to reverse some of those. All right, now let's go on to dietary recommendations and lifestyle recommendations. And hopefully I'll finish up and then we can have some questions. Maybe we should let the people that are sort of in the back outside that can't hear or see come in and ask questions to clarify. But the key understanding here with the dietary recommendations is to understand the effect of what you eat and how you live on the endothelium. Well, what is endothelium? Endo means inside, and thelium, you've heard of the epithelium, right? That's the skin here. Endothelium is the skin lining the blood vessels. And the blood vessels in the brain are highly specialized. They form what's called the blood-brain barrier. The brain, as we've talked about, is very complex and very sensitive, and the body does its best to protect the brain from toxins, from infections, from poisons, and from inflammation. But there are some things that can affect endothelial function, and when they affect endothelial function outside the brain, they also affect it there as well. Now, you hear about endothelial function a lot with heart disease and diabetes and lots of cancer and other chronic diseases. But we don't often make the link that endothelial function in my arm is also affecting endothelial function up in my brain. Now, picture with me for a moment an artery, and it has cells lining it. See, arteries are not like pipes. Pipes are made so that they don't leak, right? Well, most of the time. Occasionally, some of my plumbing in my home has leaked. But the plumbing in you is made to leak. It has to leak or the cells die, but it has to leak in a controlled way. And there are junctions between every cell and its neighbor in every blood vessel lining. And those junctions have to sense what's coming by, and they have to sense the needs of the cells on the other side of that blood vessel. And they need to loosen enough to let blood nutrition flow in, the blood sugar goes across, fats go across, and it has to be very selective in the brain not to allow things that could harm the brain to go across, but allow the good things to go across. That's true in all our body, but particularly in the brain. Now we know that there are certain things that raise the risk for heart attacks. Guess what? All of those also raise your risk for dementia, because if you disturb the endothelium in your heart, you're also disturbing the blood-brain barrier. And once that's disturbed and too leaky, toxins can go across. Beta amyloid. Has anyone heard of beta amyloid in Alzheimer's? That's the stuff that forms plaques. Guess what? We think that that is formed in the rest of the body, particularly in the gut, in the small bowel, when fats are processed and absorbed. And if the level of beta amyloid gets high in the blood, and if the blood-brain barrier is disturbed, that beta amyloid can now cross over that blood-brain barrier, which it's not supposed to do, and there's the start of Alzheimer's. You get that plaque of beta amyloid forming in the brain because of a disturbed blood-brain barrier. So anything that we can do to preserve our blood-brain barrier's integrity, we will preserve our brain function and help prevent dementia. Now you see I had linked both vascular and Alzheimer's disease, didn't I? Because they are related. It's really important to understand how related they are. They are different because vascular technically is from the tiny little blood vessels clogging up, and Alzheimer's technically is from amyloid deposition in the brain from the leaking of the blood vessels, but they're both related to blood flow. Perfect health depends upon perfect circulation. If you want to preserve your brain, you've got to have perfect circulation. Remember at the beginning I said the brain can have up to 25% of your circulation, and oxygen can go up, consumption and fuel consumption can go all the way up to 50%. Very important that we maintain our circulation. So let's look at the recommendations with this in mind. The Rush Memory and Aging Protocol found that 1 to 2 servings of greens a day resulted in the equivalent of a brain 11 years younger than those who ate few, if any, greens. Now that is a remarkable study. Why? Because of all foods, greens are particularly rich in the polyphenolic antioxidants that are necessary to maintain endothelial function. Our endothelial cells need those polyphenolic antioxidants, which are found in abundance in greens. So if you want to save your brain, eat greens. If I was in charge of this facility here, I'd make sure that everybody had a serving of greens every day. What kind of greens? Well, any green greens will work, you know? It can be broccoli, it can be kale, it can be collards, it can be cabbage, it can be kohlrabi, you name it. It can be there. And how about fresh or cooked? Well, either one are good, actually. In fact, you absorb some of the nutrients better when the greens are cooked. Don't kill them and don't smother them with grease like they do down south, but if it's cooked spinach, it's fine. If it's raw spinach, it's fine. There are some things you absorb better from raw and some from cooked. So I think the ideal, if you want to preserve your brain, is a salad and have some of those greens on the salad, and then at another meal or the same meal, a serving of cooked greens as well. Amazing that you can have a brain of a person 11 years younger than your stated age just by eating greens, 1 to 2 servings a day. And those greens preserve endothelial function. They will also help to prevent heart attacks and strokes and cancer. Greens. I want you to remember that. If you don't remember anything else, remember greens. It's amazing what they can do. The second one on the list, this mic is coming and going to some extent, but maybe it's me, I don't know. The second one on the list is berries. Berries are rich in many antioxidants. They're all rich in particularly anthocyanins. And anthocyanins are very good at preserving endothelial function. They'll also reduce your risk for cancer. They'll also help arthritis, reduce the symptoms. And I would encourage you to eat berries every day. Blueberries, blackberries, boysenberries, raspberries, goji berries, barberries, you name the berries, they all have those good compounds in them. And a half cup a day would be fine. Harvard did some very interesting studies. They took people with established Alzheimer's disease and gave them an equivalent of 1 cup of berries a day, blueberries a day, and found that those who had that compared to those that they gave a placebo, I wasn't quite sure why they give an Alzheimer's patient a placebo, because they wouldn't know the difference, but they wanted to do rigorous. I mean, this is Harvard, right? So they did the placebo-controlled trial, and there was a marked decrease in the rate of decline. Well, I'd like to get it before I'm declining, so I had berries this morning and do almost every morning. And that's a simple thing that you can do. You can have berries for breakfast with your cereal, and you can have the salad for lunch, and you can have greens for supper. And if you can remember those 3, you're going to do well. All right. There was a study published by a good friend of mine, Gary Frazier, of the Adventist Health Study, and this showed in Adventists, those that ate meat, that was red meat or chicken, had a 60 to 70% higher risk of dementia than those that didn't eat red or white meat. Now, I know I'm treading on toes here, but the good thing is if you don't do this, you won't remember that I told you. So we can still be friends. But I would encourage you to remember the counsel of the dietitian at University of Iowa who some years ago said, in the prudent American diet, animal products should be used as condiments. The real reason to eat red and white meat is because it tastes good. So use it as a flavoring or a seasoning instead of as a main dish if you want to preserve your brain function. Now, another one that we should all eliminate, and this is actually much more important than the meat, and that is trans fats. You've heard about these. They need to be eliminated from all of our diets. And how can you identify them? Read the label, and if it says partially hydrogenated, don't eat it. It's that simple. And they're all vegetable oils, and they hydrogenate them. Why do they hydrogenate them? Because the product will have a longer shelf life. The oil does not go rancid as fast if you hydrogenate it. So industry hydrogenates these oils and then feeds them to you, and then you get increased risk of dementia, heart disease, diabetes, etc. So read the labels. If it says partially hydrogenated, leave it on the shelf or buy it and throw it out, one of the two. Now, reduce saturated fats, even those from vegetable sources. Many people, many food companies have caught on that no one wants partially hydrogenated, and so they put palm oil and coconut oil instead. Palm oil and coconut oil are highly saturated fats, and they will not protect you from the development of dementia. I have some patients who are onto a coconut oil kick, and I have one who really got into it, and she was spreading that stuff on her bread thick. And about 3 years after she started doing it, I couldn't get her to stop. Her cholesterol climbed, interestingly, while she was doing it. But about 3 years after she started doing that, she developed dementia. And I know the lay press is full of articles about how wonderful coconut oil is for you. I think it's great if you want to spread it on your body, a little bit, not a lot, because you absorb it there as well. But generally speaking, if you're going to have coconut, have it like it comes in nature, on the tree, and one of those brown things that if it drops on your head, you won't have to worry about dementia. But the coconut, with all the fiber and all the antioxidants found in it, is probably safe if you don't eat a lot of it. But I would not recommend coconut and palm oil to prevent dementia. It causes it. Why does it cause it? Well, saturated fats are interesting When you eat them in large amounts, like most Americans do, the blood level of beta amyloid goes up. And the blood-brain barrier is adversely affected, and it gets inflamed, and you get those leaks. So you have a perfect storm. High levels of beta amyloid, leaky blood-brain barrier. And that's probably the first step in the development of Alzheimer's disease, at least the first step in the non-genetic type. So very, very important. The other thing that loosens the junctions between the cells in the blood-brain barrier is excess sugar. Now, we know this from diabetic studies. In fact, as I mentioned, diabetes alone increases the risk of dementia, 60 to 70%. So if you consume a large amount of sugar and it is not with fiber, like in a soda or in a real sweet dessert, you are loosening the junctions in the blood-brain barrier. And if you happen to also have a high saturated fat food with that, there we are, perfect storm for dementia. So there's good evidence on this as well, that high sugar intake. Now, let me say that sugar is not a poison. Glucose is what your brain runs on. You need glucose. It's not a poison, but you don't want to have large amounts of sugar dumped into your blood all at once. If you're eating fruit, that's not a problem. You absorb that sugar slowly, steadily, and you do great. But if you have that soda, you absorb it too rapidly, you cause endothelial dysfunction, and if you have that beta amyloid around, then you've got in trouble. All right, here's a few more just for fun. Try turmeric, or turmeric if you want the correct pronunciation, and maybe saffron or ginger. Why, all of these are potent antioxidants, and inflammation does play a role in endothelial dysfunction and in neurodegeneration. And so these have been shown to be very potent antioxidants. The lowest incidence of dementia is actually found in countries like southern India, where they have high consumption of these herbs. There are several studies where they supplemented people with dementia with turmeric and found that it's definitely slowed the advance of the disease. Now, I will say that we don't have any long-term, double-blind, placebo-controlled trials, but I don't think curry would hurt you, and so I'd encourage you to try it. It's also been found to be helpful with arthritis. It's coming and going. All right, here's some lifestyle recommendations, and then we'll take questions. Maintain your ideal body weight. Why? Because midlife obesity increases your risk. 30 minutes of moderate intensity exercise daily. Why? Improves blood flow. You improve blood flow to your legs, you're also doing it to your brain. So keep moving. Maintain a strong, healthy social network. Why? Because it takes brain elasticity and flexibility to relate to each other, right? You have to use your brain to put up with somebody. You know, if you have a happily married couple, they're doing a lot of give and take, and it keeps their brain active. There's some real truth to that. And this social network, that involves churches and clubs and quilting groups and things. All of those can be helpful. Manage your stress. Why? Because stress levels cause inflammation. The higher your stress, the higher your inflammation. Now, stress isn't all bad. It becomes bad when you go from stress to strain. And if we have any bridge builders, they'll know the difference between stress and strain. We're designed for stress, but you've all crossed the line into strain, and you need to recognize what your level is and and deal with it before it gets to strain. That's where you start having problem. Learn to play a musical instrument. You know, there's a 64% reduction in risk of dementia in those who continue to play musical instruments into late life. Yeah, I like that. And they found that if you don't play one and you take one up in midlife to late life, that also is protective. So get out your musical instruments. Learn a new language. Just speaking 2 languages will decrease your chances of developing dementia by 4.5 years. And the key, I don't mind getting dementia as long as I die just before anyone else knows, right? Yeah, okay. That's the lesson there. And lastly, avoid brain trauma. You've heard about the football players and Muhammad Ali and all these guys. Well, you know, small brain trauma, when you shake your noodle too hard up there, it causes death of neurons. And you don't want to have those neurons die. Well, you can lose a few of them, but don't lose too many, because then, you know, some people worry about their hearts. Don't worry about your heart. It's going to last as long as you live. But that may not be true with your brain, right? So you really want to protect that brain. Thank you very much. Are there any questions? Amy will bring the mic around, and I'll try to repeat the question.
What value do vitamins have, and which ones do you recommend?
Great question. What value do vitamins have, and what do I recommend? I recommend that you take supplements for anything that you are proven to be deficient in, otherwise don't take them. Why? Because vitamins are very complex. Did you know that there are 8 different types of vitamin E? And is the vitamin E supplement that you're taking, does it contain all 8? Probably not. What we know is people with diets high in vitamin E have less dementia, but we also know that people that take vitamin E don't have any benefit on dementia. Beta-carotene. Everyone wants to take beta-carotene. Did you know there are over 500 different types of carotenes? And we know that if you take beta-carotene, you will interfere with the absorption of the other 499. So I do not recommend vitamins unless you have a deficient diet. There's only been one study that shows any benefit, and that's in elderly people who are living alone and not eating well. Now, what do I mean by not eating well? Well, here's a story on my father. My mother died when she was in her 50s, and he remarried, lovely lady. She had a cerebral hemorrhage and died suddenly, and I went to visit him several times shortly after she had died. My dad was a phenomenal cook, and I looked in the pantry, which had been well stocked. You know what he had in there? Dry cereal. And I said, Dad, what are you eating? He said, dry cereal. I said, you know that's not good for you. I know, but it's easy, and I don't. So he was eating dry cereal 3 times a day. Did he need a vitamin? Yeah, probably. But that's not the way to get them in a pill. You want to eat greens and berries and beans and all the colorful fruits and vegetables. The only one you need to worry about with dementia and perhaps supplementation is B12, and I don't recommend you supplement with that unless your doctor tells you you're deficient. It's very easy to get a blood test. So I do not recommend vitamins. Great question. Any others? Just a moment. It's coming. All right.
I would like your opinion, if you would, on Dr. Perlmutter's grain brain.
Okay, great question. Perlmutter and his grain brain. The question is, are we worried about grain brains or meatheads? And the answer is Perlmutter, he's a brilliant guy, and he's right and wrong. Okay? So if you want to know where the cut point is and you want to get really technical, here it is. Get out your pen. You got it? You're writing? All right, you got it. What you want to do with carbohydrates is take the grams of grams of carb, and divide it by the grams of fiber, and you want the number to be equal to 5 or less, ideally. Why? If you absorb the carbohydrate too rapidly, carb is sugar, right? If you absorb that too rapidly, it pushes your blood sugar up. I've already told you what happens then, right? You loosen the blood-brain barrier. You raise your risk for dementia. So you look at the grains. Well, what's wheat? Well, it's got about 20 grams of carb per serving and about 2 grams of fiber. That's 10. Can you have it? Sure you can if you have some other higher fiber foods with it, like greens and beans, but you probably shouldn't eat whole wheat bread alone if you're worried about grain brain. But you can add flax to it, and flax is great because that number is about 1.5. And if you add 2 tablespoons of flax per cup of whole wheat, you got a bread that's wonderful. If you don't bake your own bread, you can go to Morning Glory and get Max Flax, or you can go to Walmart and get, if they're still carrying it, and if they're not, protest, Alvarado Street Bakery flax. It has a number 5. You won't get grain brain from it. But again, all we're really talking about that Perlmutter put his finger on is don't consume foods that push your sugar too high. Grains are a staple, and they're very, very good for us. He's wrong on that, but I'll argue with him anytime. Grains are what we should be eating a lot of, but we should not eat grains to the exclusion of fruits and vegetables that have high fiber in them. Rice, same thing. It has a number about 10, even brown rice. You shouldn't eat it alone, but who does? We usually have, something on top of it. And rice and beans is the perfect food for your brain because it's higher in fiber. Great question. Sorry for the detail, but next.
On the medications that dementia is not related to nutrition, the medications, the sleep meds, is that temporary?
It's usually temporary. It'll go away if you stop or lessen. With the benzodiazepines, the Ativan and the Xanax and those, they can build up, and it can take a long time for it to go away. Narcotics, the same thing. It's on the list as well. But that's the first thing that you want to work with if you have problems with mental function. Thank you.
Can black mold cause dementia?
I haven't tried it. Black mold can cause allergies. Allergies cause inflammation. There's a possibility, but I've read no studies on that. Next.
Meat.
Yep.
When you say, number one, when you say use it as a condiment, that would be like in a stir fry? Or
Sure, a flavoring or a seasoning.
Or a
At
small
most, a side dish.
And what is it in those?
It's the saturated fat and the cholesterol. There have been several studies that have showed that if you reduce the cholesterol in the diets of people with Alzheimer's, you actually decrease the plaques. And, we've been told for years that chicken is way better for us than red meat. With the latest dietary guidelines saying less red meat, the beef industry actually did the study, so for what it's worth. But they showed conclusively in their research that white meat, chicken, will raise your cholesterol just as much as red meat. Why? Well, chicken today is 10 times fattier than it was in the 1950s. They've changed it. We like the taste, but you don't eat white meat to help your cholesterol. We got red meat down. Processed meat is now categorized as a class 1 carcinogen. That's on the same level as smoking. Okay, so we ought to be labeling it just like we're labeling cigarettes. That's all processed meat. Red meat is right behind it, also a known carcinogen. So is white meat. We're just getting there. We're slow. Oh, hold on. Question. Yeah, either one of you. I'm not picky.
Artificial sugars like stevia.
Okay, what about artificial sugars? The only problem, stevia is not an artificial sugar, it's a plant. It grows like a weed. I've grown it in my garden, and it will grow faster than you can use it, I can guarantee you that. But the problem with these artificial sugars is they tend to stimulate appetite. That's why if you go to a fast food restaurant, you can get one of those big sodas that's artificial for cheaps, because they know if you drink that, you're going to eat more. And so we know that artificial sugars tend to make us overeat. So they're not the answer. Sorry, they're not. Stevia is okay, but don't overdo it. And sugar is not a poison. It's fine to have a sweet now and then, especially if you have lots of fiber with it. And, you know, oatmeal cookies, not a bad way to go, especially if you put some nuts in it and a little flax, and, you know, you work with it. We'll get there.
I need the skinny on two things. One, we're told that with high cholesterol, if you have very high HDLs, it's okay. And then also with blood pressure for seniors, what is the real?
Oh, my. Those are wonderful questions. So we'll take the cholesterol one first. It used to be that HDL was a really important thing. It's not so much important anymore. Why? Because everything that doctors do to push your HDL up doesn't help. But if you happen to be one of those lucky people, which I'm not, who got those genes from your parents so that your HDL is running 100 or higher, good on you. Your brain's probably going to last a long time. I've got a 96-year-old woman in my practice who's sharper than I am. I mean, she's sharp, and her HDL is over 100. It's 120. And I look at her, and her cholesterol's 240. But I say, sister, keep going. Don't talk to me about statins with an HDL of 120. So HDL is important, but there's nothing I can do about it. If you got it, great. If you didn't, I'm sorry. Don't talk to me. Other than exercise does help a little. You can push your HDL up about 4 to 5 or maybe 6 points if you exercise regularly. This thing comes and goes. Anyway, so there's HDL. Blood pressure. Oh, my. The JNC8, that's Joint National Convention on Hypertension, number 8, came out last year, and they relaxed the blood pressure numbers. They said don't treat it unless it's for elderly, unless it's over 150. And then this year, Sprint trial came out, and it said everybody needs to have their blood pressure in the 120s or lower. Well, what's the truth? We don't know, but here's my take, okay? We don't know, but here's my take. Every blood pressure medicine there is has side effects. They all do, guaranteed. There's no such thing as high blood pressure from a deficiency of a medication. That's number 2, okay? So I would like to see everybody's blood pressure less than 120 systolic if they can get it there without the use of medication. Yeah. And you can. Salt causes endothelial dysfunction. Did you hear me? Salt causes, what does it do to the blood-brain barrier? Same. Causes problems. Don't eat a lot of salt. You need some, but look at what the American Heart Association says. Less than 1.8 grams per day. That's what it says. 1.8 grams of sodium per day. That's about 3/4 of a cup, 3/4 of a teaspoon of salt. 3/4 of a teaspoon of salt a day. If you limit your salt that much, your blood pressure will drop. If you cut your sugar back, your blood pressure will drop, because sugar causes endothelial dysfunction. When my diabetics come in and their A1C or their blood sugars are way up, their blood pressures are up, because sugar causes endothelial dysfunction. Why do I keep getting back to that? If your endothelium doesn't work, you can't relax your artery. So your blood pressure goes up. If your blood pressure is high, you've got endothelial dysfunction and you're on your way to dementia. So get your pressures down and do it as naturally as you can. Drink water, watch your salt, cut your sugar down, relax, go for a walk. Increase your potassium. There's a balance between sodium and potassium. And the ideal blood pressure is somewhere between 100 and 120 if you're not using medicine. Okay, what if you're using medicine? Under 140 systolic. Under 140. And maybe less, but we don't know. The problem in the SPRINT trial is more people passed out, more people were dizzy, more people fell and broke their hips, but they had better risk factors for heart attack. So what do you want, a heart attack or a broken hip? Neither. That's why I say do it naturally whenever you can, and we'll see next year. Go ahead, wherever you are.
We are at noon, so how many more questions do you want to take?
I don't mind because my office staff is out to lunch.
Perfect.
They're not out to lunch all the time. They're just out to lunch right now. Yeah.
I had a question about gluten and transglutaminase, two leading to brain lesions that lead to dementia.
Okay, let's talk about gluten. You guys are hard. All right, gluten, it's getting a bad rap right now. And in people with celiac disease, you need to avoid all gluten. That is clear. Now that's about 2% of the population, 1 to 2%. If you have celiac disease, no gluten. And then there's gluten, not celiac, but gluten intolerance. People don't do well with lots of, what is gluten, by the way? It's a protein found in grains, particularly wheat and barley and rye. It is not found in oats, but you have to buy gluten-free oats if you have celiac disease. Why? Because they process oats with wheat flour to keep them from sticking. So it's a little tricky, but those are the main grains. And I think that the major problem with wheat is not the gluten, but glyphosate. What's that? Well, glyphosate is the active ingredient in Roundup. Yeah, and they use Roundup when they spray the field to knock down all the weeds, and then they plant the wheat, and the glyphosate is in there, and then they spray the wheat at maturity to kill the plant and allow the grain to harden and desiccate so that it will keep longer. So you got it in the ground before the wheat was planted. Now you have it on, and where is it? Does it go into the seeds? You bet. One study recently done found breast milk in the vast majority, found glyphosate in the vast majority of women's breast milk. So everybody has it. If we checked everyone in this room, had you pee in a cup on the way out, don't worry, I won't make you. But we did. 80 to 90% of you would have glyphosate in your urine. Glyphosate was first marketed as a chelator to clean boilers. So it binds minerals. It was next marketed as an antibiotic, but it wasn't a great antibiotic. Killed a lot of things, but not everything. And then it was marketed as a weed killer. But when you get it into your mouth, it disrupts the microbiome of your gut. That is, it kills bacteria in your gut. And bacteria in your gut have everything to do with inflammation. You eat a lot of meat. Here's another one for you meat eaters. You eat a lot of meat, you're going to have a preponderance of Bacteroides, and you'll have more inflammation. You eat a lot of fiber, you're going to have a preponderance of Prevotella. Prevotella makes butyrate. Butyrate reduces inflammation, and that's another reason why vegetarians have less dementia, because they have lower inflammation. They also have less other problems like diabetes and hypertension, but we don't need to go on to all that. Back to glyphosate. Your best, if you're going to have corn, soy, wheat, or potatoes, to have organic, because you can be sure there's not as much glyphosate in them. Why I say not as much? Because glyphosate stays in the ground when it's bound to minerals for 22 years. That's its half-life. It's a big problem. That's a long answer to gluten, isn't it? Okay. Man, you're getting a whole course.
One last question. Do you have an opinion on jellyfish extract that is in so many television commercials?
No. I don't have a TV, so I haven't seen it, but I do have a computer. Yeah. Jellyfish extract. You notice I didn't mention fish in general. That's because the omega-3 fatty acids in fish, and they're not in jellyfish, I don't think. Maybe. What, do you know where fish get the omega-3s from? They're just like us. They don't make them. You have to eat plants to get omega-3s, and they eat algae and get their omega-3s. But fish probably are protective against dementia. Why did I say probably? There's this other thing in fish called mercury, DDT, dioxin, PCBs, glyphosate. I mean, anything you spray on the field or whatever, it rains and then it goes into the creek and into the stream and into the river and into the ocean. And so that's the problem with fish. But if you're really careful and keep your blood-brain barrier intact so you can keep that toxin out of your brain, you're probably okay. So I recommend that you have lots of omega-3 in your diet, but that you get it from a plant source just like the fish do, and there is algal oil, or you can have flax and chia seed, that works too. They're very high. Now, they don't have the long-chain fatty acids, the DHA and EPA, that fish does, but you can convert that, and some people argue about how much you can convert, but in conversations with Dr. Fraser, who's actually done fat samples in vegans who are consuming flax and chia, theirs are actually higher than pesco-vegetarians, that is, vegetarians that eat fish. So the final word's not in. That's a long answer. I kind of went off the sidetrack. But I don't know about jellyfish unless they eat omega-3s. You have another question. Aren't you tired of this yet?
No.
Okay.
Now that we've lost Parkview, are there...
We haven't lost Parkview. I still work for Parkview Medical Associates. It's the remnant of Parkview anyway.
They did some wonderful nutrition and diet programs. Are there any additional ones out there?
Well, we did one this spring, and we didn't have enough seating for that either. They said they were going to do lifestyle choices. That's the program that I've run for 21 years. They said they were going to do it last fall, but couldn't get everything in order. I think we're going to do it this fall. Is that right, Amy? Lifestyle choices. And you know what the nice thing about Midcoast is? They do really nice advertising. And so I'm sure you're going to hear about it. And there are 2 classes tentatively scheduled, one for September and one for October. I think we're going to limit the class size to 50. But if everybody keeps wanting it more, we can offer it more often. You need to have your doctor say that it's good for you to take this course. That's all you need. And I have yet to meet a person that it didn't benefit if they followed it, okay? If you were perfect, you would have been translated by now or raptured, and so if you're here, you need it.
Well, I went to the Peace Fair. The plant ladies told me that's all I should eat, plants and beans. I'm a little confused about fish still, but they said no dairy. And I go to my osteo, whatever it is, and cottage cheese and yogurt and all that's supposed to have, so.
Okay, so your question is difficult, but I'll try to deal with one issue you brought up, and that's osteoporosis. There's no evidence that milk prevents osteoporosis or dairy of any kind. In fact, the best evidence suggests that those who have the highest intake of dairy have the highest risk for osteoporosis. And you can quote me on that, because I can back it up with science. If you're worried about osteoporosis, there are a whole lot of risk factors for it, but dairy is not the answer for it. Cow's milk was designed for baby calves. And it's not human milk. And it's constructed in such a way to cause lots of issues in humans, like increased cancer risk. It'll do that very nicely. But it is rich in calcium, but it is also rich in fats, and the calcium is saponified in the human gut from dairy. Saponification is a technical word for soap. It's made into soaps and it is not absorbed very well and is excreted nicely in your stool. So I don't recommend that you get your calcium that way. Calcium is probably overblown, and we've been supplementing too much with calcium. We now know that high levels of calcium intake raise your risk for coronary artery disease and strokes. And the most important thing that you can do for osteoporosis is use your muscles and keep yourself strong. Miriam Nelson did the studies at Tufts University. She published a book about it entitled Strong Women Stay Young, and showed that if you go to the gym and pump that iron with your legs, you build stronger bones. And I think the time has come for us to stop talking so much about diet and osteoporosis and start talking about strength and osteoporosis. The other thing that's very important is vitamin D. And if you don't know what your level is, get it measured. And if you're less than 20, either get some sunshine or take some vitamin D. You cannot get adequate sunshine in Maine from November through February. And in March, it's hard to get out there without a shirt, so maybe head to Florida. There's some studies that show that people that go south in the winter, even for a 2-week vacation, have better bone strength. That is, if they get out in the sun. Now, a lot of people are worried about skin cancer and sun exposure. No question, sun exposure, particularly burns, increases your risk for developing squamous cell and basal cell carcinoma. How do we get on this from dementia? I don't know. But there's a fellow at Harvard, a dermatologist there, who said sun prevents 50 to 100 times as many deaths from cancer as it causes. Why? Because people that get skin cancer, you can see it and they get it cut out, right, Ted?
Yes.
And people that get skin cancer seem to be protected to some degree from internal cancers, probably because of the increased levels of vitamin D. And we do know that high levels of vitamin D and high sunshine exposure reduces your risk for breast cancer, prostate cancer, and colon cancer, the #1 cancer killers other than lung. Boy, we're going all over the place here. Back to dementia, anyone? Are you? Okay, right here, dementia.
It's one of those genetic questions. People with AB blood types supposedly have a much higher risk of developing dementia. And the other 20%, is that because of environmental factors that they avoid that?
The other 20%, what do you mean?
Like if 80% higher risk for
Yeah.
people with AB blood type, then there's 20%.
You know, I'm not real familiar with the studies on blood type and dementia, but I can tell you that from the research I've done, regardless of what genes you have, you can work with the diet enough to at least bring your risk to average. Even with the ApoE3 gene, if you have it in your family, I would be really careful with copper and really careful of your blood-brain barrier. And the same is true with the other genetic tendencies. But you know, I'll be the first to tell you, genes do trump everything. They do. And I got dealt a bad hand. Coronary disease runs in my family. By the time my brother was my age, he'd had 3 heart attacks. That's one of the reasons I got so interested in this field. And we know that even if you got dealt a bad deck of cards with coronary disease, you can prevent about 90% of it. That's pretty good odds. Ornish says 99%. I'm going with 90% for now. We'll see if I make it through till later and I haven't had it, and maybe it'll go up to 99. So, all right, well, maybe that's enough. You've all been very patient and long-suffering, and if you want to look at it again, I guess it'll be online.
It will be online, and we have some handouts Judy does that you can get the URL from. I want to thank everyone very much for coming today. Dr. Howe's Lifestyle Choices class actually will be offered in the fall. If you'd like to have more information about that, you can leave your email address with us on the sign-up sheet. I know there are only 2 clipboards, but there are 5 sheets there, so we can break them out to help make this a little bit faster process for everyone. And we'll email you with those class availabilities. So thank you very much, Dr. Howe.